In this chapter, we will learn about different sources of drugs, uses of drugs, addictive drugs, and problems of their usage. Moreover, we will also discuss antibiotics, vaccines, their types and effects. Pharmacology is the branch of science that deals with the study of drugs, origins of drugs, history, uses, and properties of drugs. A drug is used to treat, cure, or prevent disease or enhance physical and mental health. The word pharmacology is derived from the Greek word pharmakos, which means medicine or drug, and logos, which means study. Pharmacology emerged as a separate branch of science in the 19th century. In fact, it is a sub-branch of organic chemistry. Oswald Schmiedeberg is known as the father of pharmacology. He was born in Latvia in 1838. A drug is any externally administered chemical substance, other than food, that modifies or affects chemical reactions in the body. A medicinal drug is a chemical that interacts with proteins in the body to affect a physiological function. For example, an anti-cancer drug binds to proteins on the surface of a cancer cell and stimulates the cell to die. Some antibiotics, like tetracycline, cause deafness, while streptomycin causes discoloration of teeth. However, no drugs are specific for interacting with just one type of cell or protein. This means that drugs may interact with any useful protein in the body and may disturb its function. This is called the side effect of a drug. Principal uses of medicinal drugs. A medicinal drug is a type of substance used to diagnose, cure, treat, or prevent disease. Medicinal drugs are used for different purposes, such as antipyretics, which reduce fever. Analgesics are painkillers that reduce pain. Antimalarial drugs treat malaria. Antibiotics inhibit germ growth. Antiseptics prevent germ growth on the external surface of the body. Sedatives induce dizziness, lethargy, and depress the activity of the brain. Vaccines are used to develop immunity against pathogen infections. Sources of drugs. Drugs are obtained from many different sources. Some common sources are as follows. Plants. Many important medicines, such as digitalis, which is a cardiotonic obtained from the purple-flowered plant foxglove. Morphine, a pain reliever drug, is obtained from opium. Opium comes from the juice of the poppy plant, Papaver somniferum. Drugs from fungi. Fungi are the source of many drugs. The first antibiotic, penicillin, was obtained from the fungus Penicillium by Alexander Fleming. Bacteria. Bacteria are a very important source of antibiotics, such as streptomycin, neomycin, and terramycin. These antibiotics are obtained from bacteria. Animals' drugs obtained from animals are usually their glandular products, such as fish liver oils, musk, beeswax, honey, some hormones, and antitoxins. Minerals. Some minerals are also used as drugs. These include iodine, which is used for making iodine tincture. The tincture is applied to cuts and wounds to prevent infection. The powder form of silver nitrate is applied to cuts to stop bleeding and prevent infection. Iron tablets are used to cure anemia, and calcium is used to cure osteoporosis and osteomalacia. Synthetic drugs. Many drugs are synthesized in laboratories by pharmaceutical companies such as aspirin. Contribution of Joseph Lister and Alexander Fleming. Joseph Lister, who lived from 1827 to 1912, was a Scottish surgeon who developed an antiseptic spray. This spray was used during surgery to keep wounds clean. Later on, it was noticed that the carbolic acid present in the spray damaged tissues and caused problems when inhaled. Therefore, he developed special dressings to keep carbolic acid away from flesh. He is considered a pioneer of antiseptic surgery. Alexander Fleming, who lived from 1881 to 1955, was a Scottish bacteriologist famous for his discovery of penicillin in 1928. This discovery is considered one of the greatest contributions to medical science. Penicillin saved thousands of lives during World War II and is now a commonly used antibiotic throughout the world.